March is Colorectal Cancer Awareness Month, and in this Ozarks Tonight, we are learning more about this disease. Colorectal cancer is the third most commonly diagnosed type of cancer in the U.S. and the second leading cause of cancer death in men and women combined. The American Cancer Society estimates more than 100,000 people will be diagnosed with colon cancer this year alone, more than 44,000 with rectal cancer, and more than 51,000 will die from the disease. The good news is screenings can catch it early and it is treatable. We will talk about signs, symptoms, and risk factors as we highlight Colorectal Cancer Awareness Month in this Ozarks Tonight. And joining us to understand this disease a little more is Dr. John Trombold with Cox Health. Dr. Trombold, thank you so much for being here with us.
Thank you for having me. It's a pleasure to be here.
So let's talk a little bit about those numbers. What do these numbers tell you? Is this a pretty high number? Have we come a long way from what you can tell?
The numbers are very important because it reinforces that this is a common disease. We see a lot of it, but the most important thing about the number is that it's less than we used to see. A decade ago, 20 years ago, the numbers were up to about 150,000 for both those diseases combined. So over the last couple decades, they've gone down, we think, primarily due to more screening. More people are being diagnosed and more people are having precancerous polyps removed before they turn into cancers even. So it's actually a good number compared to what it used to be, and we're happy about that.
Now, while these numbers are good, like you say, comparing to 10 years ago, you were telling me earlier that it's younger people. You're seeing the numbers increase among younger people because generally 90% of people who are diagnosed with colon or rectal cancer are over the age of 50. But now you were telling me you're seeing an increase in younger people, younger than 50?
Certainly, colon and rectal cancer generally occurs more as you get older, but we are seeing this disturbing trend of more people under the age of 50 being diagnosed, sometimes as early as in their 20s, or I've seen even younger than 20 before. We don't know why, but the most important part about people being aware of that is that anybody can get it. It's not just a disease of people over 50 or grandmas and grandpas, it could be anybody. So it's important to pay attention to any symptoms that could be concerning with your bowels.
Do you think awareness is a factor because maybe people who are older, older than 45, older than 50 are paying more attention to, okay, here's a screening I need to do, but then younger people, it's not something we worry about until we get to 45 and 50. Do you think awareness is a main factor here?
Certainly. I think talking about it more openly, I think primary care providers do a very good job of talking to their patients about it, and then once maybe someone in the family is diagnosed or someone's friend, then people tend to talk about it more openly, and then maybe some symptoms that they weren't thinking too much of, maybe they think hey, maybe it is something else and maybe I should have this looked into.
What are some of those symptoms and signs we should look for? Sure.
So the most common thing would be bleeding, meaning in the bowels, with bowel movements on the toilet paper, but also pain, either abdominal pain or pain when you're moving your bowels, or just not being able to have the function you used to have, whether it's more frequent bowel movements or less frequent, or you're feeling bloated. Certainly there are 100 different things that could theoretically be a sign, but those are the most common ones we see.
So when do you go in for a screening? So obviously when you're having symptoms, you check in with your doctor, but if you're not having any symptoms, when is a good time to get a screening?
Sure. So it's an important distinction to make between having symptoms evaluated and screening. Screening refers to people who have no symptoms and are of what we call average risk. So in the United States, we consider an average risk patient someone who's 50 years or older and doesn't have any bowel changes, no one in their family's had any polyps or colon cancer, and those patients are generally recommended for some form of testing starting at age 50, usually colonoscopy. It can continue until you're 75, but in reality there are very healthy 80-year-olds, 85-year-olds, even 90-year-olds out there who would benefit from ongoing screening, because as I mentioned earlier, as you get older it becomes more and more likely. For people who are high risk, that would be people who have, their parent had colon cancer, or their brother had a bunch of colon polyps. Someone in your immediate family with something like that usually gets screened earlier, usually 10 years before that affected family member had their issue. But it depends on how significant their disease was. If it was one polyp, maybe not a big deal for a family member, but if your mom had colon cancer at age 40, then you need to have your first colonoscopy at age 30, for instance. So it's individualized in that way.
Okay, so start earlier if you have a family member
Correct.
who's had it before. And then how often should we do these screenings?
So for colonoscopy, if you're of average risk and say you get your first colonoscopy at age 50, then it wouldn't be again until 60.
Okay.
And that's always presuming that nothing goes on in the meantime. Just because you had a normal scope at age 50 doesn't mean something couldn't develop at age 57. So if you have bleeding and you're 7 years since your previous scope, you should probably be evaluated again. Don't just ignore it and say, well, I'll just do it again in 3 years, because then you might miss an opportunity for intervention to prevent something.
Now, you mentioned some of the risk factors that we can't control. For example, someone in your family who might have had colon or rectal cancer. What are some of the risk factors or some of the things we can do to maybe try to prevent it?
We know that smoking increases the chance of virtually every cancer, and colon and rectal cancer is no exception. What's interesting about it is we don't really have any great protective things, like something you can go to the drugstore and get off the shelf that's going to protect you, or if you exercise every day for 50 years, you're not going to necessarily have a lower risk. So it's not that type of thing. As far as we know, patients will say, well, I just work out every day and I'm healthy and I eat well and I'm on my correct weight, so I was surprised to hear I had colon and rectal cancer. And I say, well, I'm glad you do all those things. Certainly makes it better for us to treat you if you're healthy, but it really doesn't decrease those chances. So the take home is anybody can get it.
Yeah. And just like with anything else, the earlier the better, and that's why it's so important to know your risk factors and go in for screenings.
Absolutely.
As early as possible.
Yes.
Dr. Trombold, thank you so much for being here with us.
Thank you. My pleasure.
Yes, thank you. We'll be right back with more.